we're open 24/7, 365. We serve our community with the door to come into the hospital. So if you're injured, if you're sick, if you're having a heart attack, if you're having any kind of issues, we are where you would come. Every kind of person that we can treat, we will treat. So we're kind of like the front door of the hospital, of coming in to get treatment, to get seen, to get help. And then from there, we make a decision whether or not you need to stay in the hospital or you need to go home. People can come in, obviously they can drive themselves, and they can come into the emergency room in the front. People can come in the back door, so ambulances also bring patients to the emergency room. They can come via police, so obviously, you know, if you're in jail or if you get picked up by the police can bring you as well. So really, you have any kind of mode can bring somebody to the hospital. So you have nurses that work in the emergency department, you have paramedics that work in the emergency department, medical assistants, and unit secretaries. Obviously, you have your physicians as well. Depending upon why you come to the hospital, you may have to use a lot of different services. So we have x-ray and radiology and CAT scan. We have all of that in the department. Lab touches our department because we send a lot of lab upstairs. OR, so if we have to send a patient to surgery really quickly, they work with us. Our interventional studies, they work with us if we have to send a patient there. If we admit a patient and we have to send them upstairs to rooms, then we obviously have to have a lot of communication there. So I don't really think there's not a service that we don't probably integrate with somehow in the hospital. We see about 30,000 pediatric patients a year, which is huge and amazing for this community to have a place to bring their children to be seen. We have amazing physicians and amazing nurses over there who really cut their care out to look, you know, and to be what the pediatric community needs in our community. I've been a nurse for 11 plus years at this point in time, and I'm always a little amazed at just the innovations and the things that we come up with to take care of patients. So I do believe that it's ever changing. You're never fully knowledgeable because tomorrow something can be different and there's something new to learn. So absolutely, we'll see changes forever and ever.
Here in the laboratory, we have a couple different sections that do vastly different things. We have a blood bank, which determines what type of blood type you are and can cross-match units so the doctor can transfuse blood should you have low blood counts. Chemistry, they're going to analyze your blood, decide if you're deficient in anything that may help the doctor diagnose any conditions, and they can determine whether you have the right amount of antibiotics in your body to fight the infection you have, and maybe when it's the next time to have a new dose of antibiotics. In microbiology, we determine which microorganisms are causing infection, and we tell the doctors what that organism is, what will kill it, and make sure that the doctor has the patient on the right antibiotics. The laboratory is 24 hours a day, 7 days a week. Anytime there's a patient in this hospital, we have to be here to make sure that we're kind of behind the scenes, giving the doctors and nurses the information they need to diagnose and treat the patients of the hospital. We do investigate new technologies that can help our patients. We have to make sure they're feasible for the type of hospital we run and the patients we have. We're always looking for better ways to treat our patients. Anytime we can get information quicker to the physicians, the quicker they can diagnose the patients and start treatment, the better outcomes our patients have.
The Midtown Medical Center Department of Pharmacy provides medications for each of our patients here in the hospital, both inpatient and outpatient. We also provide a pharmacist for each of our patients in the hospital up on the floors. So we have decentral pharmacists that work to provide for pharmaceutical needs for each of our patients, making sure that all of their medications are correct and doses are appropriate. We have pharmacy technicians that actually prepare the IV medications for patients, and then as those IV medications are prepared, the pharmacists go back and check to make sure each of those medications are prepared correctly, and check to make sure everything is done in a sterile fashion. And we want to make sure that each of our medications that are provided or prepared in the IV room are prepared correctly, accurately, and for the appropriate patient. We have a robot that provides medications to a 24-hour supply of medications for each of the patients on the floors. The robot knows exactly what medications each patient is supposed to receive, and it picks those medications for each of the patients and puts them in an envelope to be delivered to the patient care areas for each patient. Specific putting of medicines on the pegs was making sure that the robot is restocked appropriately. We want to make sure that the medications that are in the robot are what they say they are, and that we keep the robot well supplied so that it can pull all the medications it needs for the patient. There are lots of different technologies in pharmacy. We are all the time pursuing different areas of technology to advance pharmacy. That doesn't ever take the human element out of it. You always need a pharmacist to provide the specific patient care to patients, and also just to check for accuracy and to ensure that our patients are provided great care.
So the NICU stands for Neonatal Intensive Care Unit, and we are a unit that cares for neonates that are born as early as 17 weeks early, and a mama usually has her baby inside for 40 weeks, and our babies will sometimes start at about a pound. A pound is probably about the size of a potato, and the length of about $1 bill, and we take care of those babies, and we usually take care of, every nurse usually takes care of about 3 babies every day. Well, a typical day for a bedside nurse starts at about 7 a.m. in the morning or 7 p.m. at night. They start their day finding out what kind of shift the baby had the shift before. They'll come in, they'll look at their baby, make sure their baby looks okay. They'll feed their baby, they'll teach the mama how to take care of the baby, and they just do everything that baby needs so that that baby can be safe and grow big and go home. We are just one of the many inpatient units within the hospital, and we're the one unit that specializes in the care of neonates. And we're actually the only one in the area that actually cares for the smallest, sickest babies. The NICU is a place where you kind of start at the beginning of life, and you get to see babies at their most fragile. And these babies start out really small, but you'd be amazed at how strong these babies really are.